What is advanced heart failure or refractory heart failure? The condition is considered advanced or refractory when all therapies or symptoms management strategies what they adopt by doctors is no longer working. So if you are a heart failure patient, if the therapy what you are taking or adjusted by your doctor is not working, that is called advanced heart failure. So all advanced heart failure require advanced therapy because advanced heart failure carries very high risk and mortality if it is not treated. So there are many other conditions which can mimic advanced heart failure because there may be non-adherence to the therapy. There may be acute ischemia, that is, there is a blockages in the blood vessels, or uncontrolled blood pressure, excessive salt intake, or they develop irregular heartbeat, or it can be some medication which is not good for your heart like painkillers and some nifedipine and diltiazem, all those things, or somebody can develop pulmonary embolism. All this can mimic advanced heart failure, but they are all treatable heart failure. All this heart failure is a very advanced stage. They are either in a critical stage in the hospital or maybe walking around with a lot of disability. There are very simple clues which can be detected or you can consider or it can be recognized as advanced heart failure, like when somebody requires very high dose of water pill or also called as diuretics, or those who are not able to tolerate the medicine, the blood pressure medicine like ACE inhibitor, ARBs and beta blockers, and BP start falling with this medication. Or then maybe those who are having ICD for heart failure, it is start shocking excessively, and those who are getting into renal problem and unintentional weight loss, so they started losing weight unintentionally. These are the situation where you can consider as advanced heart failure. So these advanced heart failure, they have very frequent admission rate and each admissions carry mortality. If you take a first admission, got 25% mortality. If a fourth admission in a year, it may be a 60% mortality. So the best thing to treat is to prevent admissions so that they are optimally treated. We have lot of options for these patients. One is chronic inotropic therapy. Second is heart transplantation. Third is ventricular assist device, also called as artificial heart, or when none of these are possible, we have to put them on palliative therapy. So if you're coming to left ventricular assist device, artificial heart, these devices are available either as a temporary device where we can put this device as a single chamber support or both chamber support, and these patients can be in hospital till heart is available. And left ventricular assist device which can be implanted totally into the chest is available. That can be as a destination therapy or can be bridged to the transplant. So those who are bridged to the transplant has to undergo heart transplantation in the near future to have a better long-term prognosis. So these left ventricular assist device are as excellent long-term prognosis, especially a newer devices which is available today, which has got very low stroke incidence and good functional capacity for a long term. Heart transplant, which is much cheaper in this country compared to artificial heart, and excellent long-term prognosis. Heart transplant, you need a donor who is a brain dead, where we take a harvest heart from the brain dead donor and we transplant it to a recipient who needs heart transplantation. It is a lot of a complex procedure which is involved. We need a approval from the agency which deals with the donor heart or donor organ procurement, and this process we can improve survival among these patients. Once the transplantation done, these patients' long-term prognosis is excellent. The 5-year survival may be 85% and 10-year survival is 75% with good functional capacity. Most of them who undergo transplant, they go back to their work, they start working and taking care of this family.